history of HIV and AIDS is fascinating in a way. And it's so important, this being the 30th anniversary of the discovery of HIV, because when it first came out, people didn't really know what was causing it. And then when they realized and they knew it was a sexually transmitted disease, there was a stigma around it.
People have to remember that this virus was discovered when people started to die from it. There were unexplained deaths of people who were found to be suffering from a very strange terminal immunodeficiency, and the hunt was on for the cause of their deaths. So in fact, this was known as a killer before the virus was even found. In the early days, this was seen as a life sentence. No one knew how long it would take for HIV to kill you.
30 years has passed since the first diagnosis of HIV, and a lot has happened in the last 30 years. I mean, the knowledge base about HIV has expanded enormously. The way we understand sexual behaviors and risk. But of course, the epidemic has expanded as well. It is a global epidemic, and the numbers are perhaps, the numbers of people living with HIV and the numbers of people infected every year are enormous as well.
In 1996-97, the breakthrough with the antiretrovirals and the AIDS cocktail per se, and it took a couple of years for the results of that to be seen and for the death rate to be falling considerably. And it's interesting that through the late 80s, people were confused about the disease and who would get it and how they would get it. By the 1990s, they understood more about it. And certainly, people didn't appreciate how difficult it was to get and how much they would be at risk. And by 2000, 2001, people realized that the AIDS cocktail was really controlling the death rate. And so people are living much healthier, longer lives through that period. And the solution, as we've proven, is through research.
But it's by no means an easy life. So it's become a chronic disease, but we've made some major gains. And the lives of hundreds of thousands of people have been saved from research.
It means, however, that there's a new kind of challenge because people living with HIV are living longer. And this means new challenges for them as individuals, but it's also a new challenge for public health authorities in how to address their needs. So we're entering, or we have entered in recent years, a new phase in thinking about HIV, which is about HIV and aging.
Now all of a sudden these individuals are hitting their retirement. Instead of being able to live into their 80s healthy, early on in their retirement, they're slowing down much quicker than we had hoped. So now we have that conundrum to deal with.
One of the real challenges of addressing HIV is stigma. And in that context, people will want to draw distance between themselves and HIV and between the people who are infected. HIV has also affected some population groups to a greater extent than others. So, for example, gay men and other men who have sex with men, black people, sex workers, and so on. So in this context, there is an incredible amount of stigma attached to HIV. And part of that stigma, part of addressing, people want to sort of think about that stigma, but what they also want to do in the context of HIV is to attach blame.
So I think as Canadians, we have to stop and ask ourselves whether in fact we're paying enough attention to that. I think that that's a question we all have to think about and sort of turn over some of these stereotypes that we're looking at. HIV has become a disease of disenfranchised individuals, and it will continue to do so, and it will do so around the world. HIV is rapidly becoming a disease of the poor, of people without access to services, and of people who traditionally have had problems accessing messages about how to take care of themselves and how to prevent disease in general. HIV as well affects young, healthy people. The most rapidly increasing subpopulation to get HIV right now is young women. I think the public is starting to realize that HIV is not just a gay men's disease. This isn't a disease that needs to be primarily examined as a social disease. It's just a virus, like any other virus or bacteria. It has no social agenda. The reality is that HIV risk is climbing, and that the rates of HIV acquisition from unsafe sex are climbing. Human behavior is really influenced very little by our traditional public health messages. And so we need to start to understand better about how we can make it easy for people to have safer behaviors.
There are many different ways of giving that safe sex message. And some of those ways probably are diluted and in some cases probably rightly so. But I think that one of the things that we must recognize is that there's been a real change in how we understand risk and how individuals can take steps to maintain their safety.
The new advances that we have now, where we're actually making changes in the host's immune system, where we're taking therapy and helping not just the person on the treatment, but we're showing that their sexual partner doesn't get infected because their viral load is so low they can't transmit. Where a mother who's treated can't transmit to her infant, plus she's living long enough to take care of her whole family, and her husband doesn't get infected. I'm very pleased with where a lot of the research on HIV has gone, and our approach and the approach of many researchers has been to focus on vaccines that are going to be cost effective and useful, not just here but also worldwide. Because there's no question the calamity of HIV and the calamity of the outcome of HIV will take us all down, not just in North America, but we have to address this in the developing world too.
So there are still challenges that we need to deal with, and ultimately what we need is a cure. And I think the real message in many ways is that this has been a tremendous success story, but we're not finished.
In the meantime, there's a lot of work, a lot of research, a lot of thinking, a lot of advocacy being done about some other approaches that I am sure will bear fruit in the not too distant future in terms of limiting the spread of HIV.
We've made tremendous progress. There's no question in my mind that we are going to continue to see medical victories on this. So I'm very optimistic, and I think Canada, God willing, and with a little more support to some of our scientists, can make a tremendous contribution.